Hi, this is Andrew with Eskimo TV, and I'm very happy to be joined by Dr. Janet Brill. She's a registered dietitian and nutritionist, and also a best-selling author. She's nationally recognized for her expertise in nutrition and fitness and cardiovascular disease prevention. Dr. Janet, thanks so much for being with us today.
Thank you for having me. Pleasure.
The topic we're going to talk about is women and heart attacks, the #1 killer of women. Why do more women die from heart attacks than men?
Well, first of all, I'm really glad that you pointed out the fact that heart disease is the #1 killer of women. A lot of women still don't know this. I'm a spokesperson actually for the American Heart Association Go Red movement, where we are trying to make women aware that heart disease is the #1 killer, and also that all women should take control of their heart health, and that heart disease is a preventable disease. So all women need to understand that they should be living a heart healthy life, they should know their risk factors, and they should get those risk factors under control, know their numbers, get their numbers under control. So why do more women than men have heart attacks and stroke? That's a great question. I would have to say that it's probably because many women still are not aware that they are at risk and that they will die most likely from a heart attack or a stroke. They probably think that they're worried about their husband's heart when they need to worry about their own hearts first. Secondly, the symptoms of a heart attack are different in women than in men. Women generally don't have that classic elephant on the chest, Hollywood depiction of a heart attack with the pressure. Most women that have heart attacks actually just felt like they had the flu or they had unusual fatigue. So the saying is, when it comes to heart disease and heart attack, time is muscle. So that means if you're not feeling well, you need to get yourself to the emergency room ASAP, because you could save your life in that respect. So also doctors are not as aggressive in treating women. So if a woman has a heart attack, she's less likely to survive within a year than a man, simply because they're not treated, as I said, as aggressively. So there are a whole host of reasons why, which is why women need to take control of their own heart health and educate themselves.
Does having normal blood pressure and cholesterol levels mean that you shouldn't worry about suffering from heart disease?
Well, it's great that if you know your blood pressure number and that if you have that under control, that's fantastic. That's only one risk factor, though. Cholesterol is a major risk factor. You want to get that under control. If you have a good cholesterol, fabulous, that's great. But there are plenty of other risk factors. So if you have heart disease in your family, especially if your mother or father had a heart attack before age 45, that puts you at tremendous risk. If you have overweight and a sedentary lifestyle, that puts you at great risk. If you have diabetes, that's a fast track to a heart attack, so you need to take care of your heart. So there are plenty of other numbers that you need to understand and you need to know and you need to take control of to prevent a heart attack or a stroke.
Is it true that taking an aspirin a day will lower your chances of suffering a heart attack?
You need to discuss that. Women need to discuss that with their cardiologist. Generally, the advice is postmenopausal women should be taking a baby aspirin a day, but again, that all depends on your personal health history, so that needs to be discussed with your physician.
What are some signs women should look out for when trying to take care of their healthier heart?
Well, as I say, when you don't feel quite right, then you need to get yourself quickly to see your doctor or to the emergency room in all aspects. You need to know your body and understand that heart disease is the #1 killer of women. And again, check those risk factors and get all those numbers under control. If you get your numbers under control, then you will be doing what it takes to prevent heart disease and to live a heart-healthy lifestyle. So all Americans, women, children, and men, of course, need to be living each day in a heart-healthy manner. That means eating healthy foods that are good for the heart, and also getting that exercise in, getting the body weight down to a healthy number, as well as all the other numbers that we talked about.
In closing this topic about women and heart, can you give any closing advice about what women maybe can do to help prevent themselves from suffering a heart attack?
Yes, the science is there. One of my favorite studies actually is out of Sweden, and it showed that there were basically 4 lifestyle factors that if women followed, they cut their risk of an MI or a heart attack by some astronomical number like 91%. And those 4, I call them the Fantastic Four lifestyle measures. 1 is, of course, a Mediterranean diet. 2 is a alcohol moderation, which would be a glass of red wine, no more, no less, every day with dinner, which goes along with the Mediterranean lifestyle. Number 3 is exercise, at least 30 minutes of some kind of exercise every day, such as walking or biking or dancing, whatever you like to do. So being active. And the last one would be to get your weight, a healthy body weight, and not smoke. So get that weight down. That's very important. And for God's sakes, don't smoke. And those are the Fantastic Four lifestyle tips that should keep you ticking strong and give you a long, healthy life.
Dr. Janet, thank you so much for sharing this advice and helping women learn more about preventing heart attacks and taking care of themselves better. Thank you so much.
Thanks for having me.